Are you feeling stressed, overwhelmed by too many tasks that you have to do, too many things to consider, and juggling everything around, feeling exhausted from everything? You're not alone with that. Stress is an omnipresent issue in our modern society. With increasing demands in both professional and personal life, more and more people experience chronic stress, which can have significant impacts on health. According to a 2021 WHO study, about 60% of employees globally suffer from stress-related health problems, including cardiovascular diseases, chronic pain, sleep disorders, and mental health issues such as anxiety or depression. But what's the relationship between chronic stress and these symptoms? I'm Dr. Aisha, and I'll explain how it works. Stress is your body's reaction to challenges or pressure. Whether it's a deadline, an argument, time constraints, or an unexpected event like an alarm going off. Your body responds to these situations to temporarily boost your strength and prepare you for fight or flight. Surprisingly, acute stress can have short-term benefits for your immune system. It triggers the release of stress hormones like adrenaline, which mobilizes your immune cells and boosts your body's immune defenses. This is basically an evolutionary mechanism to help the body respond quickly to injuries or infections, making it a really good survival tool. In modern life, however, this system can misfire, activating even in non-threatening situations such as work, pressure, or social conflicts. Chronic stress occurs when the body remains in a state of heightened alert for an extended period of time, such as for a couple of weeks, without adequate recovery. The constant high alert and activation strains your entire system, your entire body. Over time, chronic stress can lead to many health problems. It suppresses the immune system, disrupts metabolism, and contributes to mental health issues. It also affects cognitive functions like memory and concentration, which basically leads to a vicious cycle of stress and reduced efficiency. This is because your stress axis, or HPA-Axis, gets out of balance. I'll explain shortly how it works. The HPA-Axis, short for Hypothalamus-Pituitary-Adrenal Axis, is the central system that regulates your stress responses. The hypothalamus, an area in your brain, recognizes stress and then sends signals to the pituitary gland, which is also in your brain, using a hormone called CRH. The pituitary gland then releases ACTH, another hormone, into the bloodstream. ACTH then goes through the bloodstream to the adrenal glands, which release cortisol then, which helps the body prepare for challenges by mobilizing energy and suppressing inflammation. The HPA-axis usually has a negative feedback loop if it works correctly, so that it regulates the cortisol response. But in chronic stress, this feedback mechanism doesn't work anymore. The HPA-axis remains overactive, leading to dysregulation, either excessive cortisol production or depleted levels due to exhaustion. The different effects chronic stress has on your body are increased risk of hypertension, heart attack, and stroke in your cardiovascular system, a lowered defense in your immune system, making infections more common and recovery slower, weight gain, insulin resistance, and higher risk of type 2 diabetes due to the excessive cortisol release. The psychological effects are anxiety and depressive moods, irritability, but also difficulty concentrating, memory issues, and to being overwhelmed with complex tasks. Also sleep problems like trouble falling asleep or staying asleep, which affects your recovery and contributes to the vicious cycle. If you suspect you're dealing with chronic stress, here are some steps to take. First of all, be aware of the stress. Keep a journal, for example, to identify stressors and specific patterns. Reflect on whether you feel persistently exhausted or have unexplained physical symptoms. Talk to someone you trust and listen to external feedback. Here's also some other strategies for relief. For example, exercise. Regular physical activity reduces stress hormones and improves well-being. Even a daily walk helps. or relaxation techniques, meditation, for example, or breathing exercises, or progressive muscle relaxation can calm your nervous system down. Also, structured routines like schedule breaks, set boundaries between work and leisure, and prioritize tasks. Practice being present through gratitude rituals or savoring simple pleasures. Seek professional help if you feel overwhelmed or notice worsening symptoms like persistent anxiety or insomnia. Also, if physical symptoms persist, consult a doctor. So, to sum it up, chronic stress arises from a prolonged activation of the HPA-Axis, keeping the body in a constant state of alert. This can lead to physical and mental health issues, emphasizing the importance of managing stress proactively. While acute stress can be beneficial in small doses, it's essential to allow for recovery to avoid long-term harm. Regular exercise, relaxation techniques, and mindfulness can help restore balance. And remember, don't hesitate to seek support if you're struggling. Thank you for watching. If you found this video helpful, please give it a like, share it with your friends, and subscribe to my channel for more health and psychology topics. Thank you, and see you next time.